Okay, so there's this incredibly powerful painkiller kind of hiding in plain sight in millions of medicine cabinets. You probably know it as Aleve, but we're talking about Naproxen. It's so many people's go-to for all sorts of aches and pains. But here's the thing, that easy access, it masks some really serious, complex risks that we absolutely need to unpack.
Yeah, you've definitely seen it around. Brand names like Aleve, Naproxen, Naprox DS, they're everywhere. And that's because you can grab it over the counter for, a simple headache, but you can also get it in much stronger prescription forms for things like chronic arthritis. That's what makes it so common. And that's the real kicker, isn't it? That's the crucial balance we're going to dig into. Look, Naproxen is fantastic at what it does, knocking out pain, calming inflammation, but that kind of power doesn't come for free. There are some significant risks here that, honestly, anyone who takes it really needs to get their head around.
So that's what we're going to do. Over the next few minutes, we're going to break all of this down. How Naproxen actually works, the right way to use it, and, this is the most important part, the critical warnings you absolutely cannot afford to ignore. All right, so first things first, let's start with the basics. What exactly is this drug, and what's it really for?
Okay, so at its core, Naproxen is what's called an NSAID. That stands for Nonsteroidal Anti-inflammatory Drug. It's a bit of a mouthful, but the name tells you pretty much everything you need to know. Its two main jobs are to fight pain and to bring down that swelling that comes from inflammation.
And boy, is it used for a lot of different things. I mean, it's a real workhorse. Doctors use it for those long-term chronic conditions like rheumatoid arthritis, but also for short-term acute stuff. Things like menstrual cramps, tendinitis, and even those horribly painful gout attacks. But how does it actually do all that? Let's dive into the science, the how it works behind the relief. So the secret sauce is all about these things in your body called prostaglandins. The easiest way to think of them is like your body's built-in alarm system. When you get injured, your body floods that area with prostaglandins, and they're the ones screaming, "Hey, pain, swelling, over here!" What Naproxen does is it basically cuts the wires to that alarm. It blocks the production of prostaglandins, and by doing that, it silences the pain and calms everything down.
So you might be wondering, how is this different from something like Ibuprofen, another super common NSAID? Well, the key difference, the big one, is how long it lasts. Naproxen's effects stick around for a while, which means you might only need to take it every 8 to 12 hours. Ibuprofen, on the other hand, is much shorter acting. You got to take that more often, maybe every 4 to 6 hours.
And listen, this is a really important point to make. Naproxen is not a narcotic. It's not an opioid. It works in a completely different way in your body, and it does not, I repeat, does not carry the same risks of addiction and misuse that we see with opioid painkillers. Totally different class of drug.
Okay, now let's talk about dosage. This is not a one-size-fits-all kind of situation. How you take Naproxen isn't random at all. The right dose is very carefully tailored to whatever it is you're treating.
And you can really see that here. For something chronic like arthritis, you're probably looking at a steady, lower dose twice a day to just keep that inflammation in check long term. But for a sudden, acute gout attack, whoa, the strategy changes. A doctor might hit it hard right away with a big initial dose to get things under control, and then back it off. It's a perfect example of why you have to follow your doctor's instructions to the letter.
Okay, let's shift gears to something that's incredibly important, side effects. Like any medicine that actually works, Naproxen has them, and it is so crucial to know the difference between the common, maybe annoying stuff, and the really serious red flags. So on the more common side of things, you might run into stuff like an upset stomach, a bit of heartburn, maybe you feel a little dizzy or gassy. Generally, these are pretty mild, and they tend to go away on their own.
But these are the symptoms that are not okay to ignore. I'm talking chest pain, trouble breathing, sudden weakness on one side of your body, or, and this is a big one, black, sticky, or bloody stool. These are not wait-and-see symptoms. These are signs of a serious, potentially life-threatening reaction. If you experience any of these, you need to get medical help, like right away.
And that leads us right into what is probably the most critical part of this entire discussion. We have to talk about the most serious warnings that come with Naproxen.
Say this drug has what are called Boxed Warnings from the FDA. And when you see that, you need to sit up and pay attention. A Boxed Warning is the most serious alert the FDA puts on a drug. It's their way of saying, hey, this medicine carries a significant risk of severe, maybe even life-threatening side effects.
Okay, so boxed warning number 1 is all about your heart. Taking Naproxen can increase your risk of having a heart attack or a stroke. That risk gets higher the longer you take it and the higher the dose. And it is an absolute no-go for managing pain right before or after you have heart bypass surgery.
The second warning is just as serious, and this one is about your stomach. Remember how we said Naproxen blocks those pain-causing prostaglandins? Well, the problem is it also blocks other prostaglandins that have a really important job, protecting your stomach lining. Without that protection, you can get ulcers and bleeding in your stomach and intestines. And the truly scary part? It can happen at any time, with 0 warning signs, and it can be fatal. The risk is especially high for people over 65.
And on top of all that, you absolutely have to be aware of the interactions. Mixing Naproxen with alcohol? That seriously ramps up your risk of stomach bleeding. Taking it with other NSAIDs, like aspirin or ibuprofen? Same deal, even more risk. It can also mess with your blood pressure meds, making them less effective. And combining it with blood thinners like warfarin, that is incredibly dangerous and significantly increases your risk of a major bleed. So, wow. After hearing all of these warnings, the big question is, how can you use this powerful tool safely? Well, it really all comes down to one thing: being informed and being proactive about your own health.
Let's break it down into 4 key steps. Step 1. Talk to your doctor first, always, and give them your full health history, especially anything to do with your heart or stomach. Step 2. Follow the golden rule of NSAIDs. Use the lowest dose that actually works for the shortest amount of time possible. Step 3. Know those signs of a serious reaction. I mean, really know them. And Step 4. Just be super careful about avoiding those risky combinations with alcohol or other painkillers. So, here's the bottom line. Naproxen is a powerful, effective tool for managing pain. No doubt about it. But it is not risk-free. That power demands respect, and it demands that you have a really clear understanding of what you're dealing with.
Because in the end, powerful relief requires powerful knowledge. It's not just about popping a pill to make the pain go away, it's about understanding the tool you're using. So I'll leave you with this question. Are you asking the right questions about the medicines in your cabinet?